Greetings. So, in this lecture, we are going to talk about vaccinations. And with vaccinations, what are we trying to do? So, again, we would have a microorganism which by itself or will produce some kind of toxin, right, will cause us to get sick, right? Our body will fight. And we have two possibilities, or actually three possibilities. We are going to live healthy, we are going to live, but we're going to have some disability, and or we are going to die. So the goal of vaccinations is, can we prevent the person from getting sick? And from a public health perspective, what we're trying to do is, look, if I can get a host to become immune to a particular microorganism, then you know what? They're not going to get sick. And if I can do that for a percentage of population, then I will develop what I call herd immunity. So that is a certain amount of population in the community that is immune, which then means that as a society, I don't have to worry about that sickness anymore, and the burden of disability and death due to that sickness goes away. That's a brilliant idea. We actually are engaging in preventing diseases. And we all know a stitch in time saves nine. Prevention is so much better than cure, right? Okay, that's a beautiful concept. Now, what goes on? Or how do we do it? And so again, vaccination, way to acquire immunity and not get sick. That's what we talked about, right? Now, remember when we talked about immunity, we talked about innate and adaptive immunity. Adaptive immunity is towards a specific agent, right? And that's what we need to acquire against a specific microorganism so that we are now immune to it. So that's our goal. You know, when we give vaccinations to somebody, what we are doing is we are giving them adaptive immunity to that particular disease. Okay, that makes sense. Now, there's two ways to acquire this adaptive immunity. What are the two ways? So the first way is, you know what? What I will do is, if, let's say I have a disease, right, which is caused by a certain microorganism, okay? Now, that microorganism, the way we develop immunity to it, let's take an example, is by IgG antibodies. And if you're not sure about antibodies, watch my anatomy and physiology videos. So let's say if I have a microorganism, say X, okay, and the the way my body develops immunity to this is by creating IgG antibodies against X. Because remember, this is adaptive immunity. It is against a certain microorganisms. How I have two possibilities. Well, I can give the patient this IgG antibody. And when I do, you know what? You know what? If the patient comes into contact with X, these IgG antibodies are going to fight it and prevent it from causing disease. Okay? Does this happen naturally? The answer is yes. How? Well, mother and baby, while the baby is in the mother gestating, and mother passes on some protective IgG antibodies. to the baby. So when the baby comes out, the baby's immune to several diseases. Beautiful, right? That's natural. Can we give it artificially? Yes. So technology and biotechnology has allowed us to isolate these antibodies and give it to patients when we think they've been exposed to this disease and they don't have immunity to prevent the disease from taking hold. Okay, so here what we are doing is the body is not working to develop the immunity. We are actually giving them the immunity. So this is a passive process or way to acquire adaptive immunity. And so the body does not work to produce antibodies or develop immunity. And again, we have the artificial, which is where we give the antibody, and natural, where there's a natural process where mama gives it to the baby and protects the baby for up to 6 months, right? Artificial is when we artificially produce these antibodies or fighters and then we give it to the patient, okay? So that's one way of looking at it, okay? Okay. Now, what's the other one? The other one is where the body has to work to produce this antibody or this resistance. So in one case, I just gave it to them. The other one, the body has to now work. Okay. Now, can it happen naturally? Yes. So the patient can get a disease, and naturally the body is going to work, produce immunity, and the patient will become immune. Now, again, there's a chance patient might have disability or death as a result of this. But what we can do is artificially give them um, give them certain agents that provoke an immune response, which now works against the disease or the microorganism. So again, one is natural active, the other one is artificial active. Okay? One is natural active, the other one is artificial active. So now if you see this, I have active, artificial, and active and passive artificial, right? I have these two processes. They're both artificial. One is actually giving them a certain agent against the microorganism, a certain agent which will then encourage the body to produce immunity or against a certain microorganisms or toxins. The other one, I actually give them artificially created immunity. Both of these are under the umbrella of immunizations. Okay, so essentially, what is the concept? The concept is for giving somebody vaccinations, I either give them the actual immunity. So I give them either IgG, if that's the marker, or any other. The other one is I give them a certain, either a dead microorganism or a part of more microorganism or toxin that goes into their body, and that's what we call an antigen. Okay, and essentially what the body produces is an antibody to that particular antigen. Okay, and when it does, when the real microorganism comes with the antigen, guess what? The antibody is in the body, recognizes it, and boom, tags it, and then the immune system goes after it. Okay? So that's essentially what we are doing. So again, we are vaccinating. Again, you have artificial active and artificial passive. Now, there's some benefits and some, downsides to both of those. So in other words, None of those are perfect. However, they complement each other very well. So when we give somebody the actual immunity, so in other words, we're giving somebody the actual antibodies and they don't have to work for it, that's artificial passive, right? It's immediate. Because remember, IgGs in the body take a while to develop. Okay, they take a while to develop. So if I am giving somebody IgGs, I am cutting that time away because the body doesn't need the time to prepare them, right? So it's immediate. However, it does not last long. So again, good part, immediate, bad part doesn't last long. When we give somebody a part of the microorganism or dead organism, or attenuated organism, and we force their body to create IgGs. Now, those IgGs, the body remembers using the memory cells. And when it sees the antigen again, whoop, it starts to go into overdrive by developing these IgGs and cloning these IgGs. So it is long lasting, it's much longer lasting. However, it's not immediate because remember, antibodies sometimes take a while to make. Okay? So now the question is, how can we use this information? Um, you know, so let's say a patient comes in with needle stick and is worried about Hep B, and the patient does not have history on any Hep B immunization. So what do we need to provide them? So again, we need to provide them artificial passive. So these would be antibodies against the Hep B virus because they would protect the patient immediately. And we also need to provide them artificial active um, immunity, which is Hep B vaccine, because what we want to do is we want this situation not to occur in the future. So in other words, we want them to get the antibodies so that they can fight any Hep B they've been exposed to now, and also start the process of developing immunity to Hep B. And so we give them both artificial passive, artificial active. We give them Hep B vaccination and we give them Hep B immunoglobulin. Beautiful, right? Yes. Okay. So with that in mind, let's talk about vaccine and vaccine types. And when we are looking at how we organize vaccinations and things to remember, that's going to really cut down on what we need to remember. So there's two kinds. There's a live attenuated vaccine. So in other words, you get a vaccine which has a weakened antigen. The big example is measles, mumps, rubella, and chickenpox. Okay? These are the big, high-ticket, high-yield items. And then there's inactive vaccine, which has got dead antigen. So let's think. Let's say I have HIV, and now it's progressed to AIDS, and I'm taking immunosuppressants for my psoriasis. Okay? And I'm on bone marrow transplant for my leukemia. And I'm also doing chemotherapy for my melanoma. Okay? Wow, I'm a really sick person, right? But what is all of this going to do? Suppress my immunity. It's going to basically take it out. So if I'm given an inactive vaccine with dead antigen, can I get the disease? The answer is no. Because it's dead. Can't replicate. However, if me with a very low immune system and is given a live attenuated vaccine, that antigen may be weakened, but it's not dead. So in a normal person, that antigen is going to produce an immune response without making the person sick with the disease. But in a patient with very low immunity, that antigen, although weak, is still strong enough to overcome the low immunity of the host. So when it comes to two vaccines, two types, Live attenuated vaccines, we have to be very, very, very careful when giving to patients with lowered immunity. And we're going to touch bases regarding this in this section again when we talk about immunizations and when to give it and when not. The next thing is immunization schedule. Do not learn it. Doesn't help. Because the schedules change within US, and if you're outside US, the schedules are different as well. So there's no point committing it to memory because it's going to change anyways. Okay? What is high yield is vaccine reactions. That is what I want you to learn because what usually shows up on the tests, and that's where we are required to review our clinical judgment. Okay, so the thing to remember is give the vaccine, give the vaccine, give the vaccine. Now, there's very few contraindications to give vaccines. And what are those contraindications? There are 3 that I'm going to list for you. And then we will talk about how to apply this information. First, if the patient has anaphylaxis to any of the vaccine components, do not give the vaccine. That's 1. 2, if the vaccine is live, attenuated vaccine, and the patient has low immunity, they have AIDS or any kind of immune deficiency, acquired or congenital, they're on biologics, they're on chemotherapy, they are taking lots of steroids, they have pregnancy, that causes the immunity to become altered. And when we're looking at pregnancy, we're looking at the baby, the fetus, that doesn't have the best of immunity. So again, these are all areas where one needs to go, hold on, should I give this vaccine or should I hold it? And then there's a third part to it. And this is what I call a pediatric consideration. So usually babies get vaccine, and sometimes babies will get fever, and babies will be fussy when they get home from taking the shots. Now, when you give somebody an immunogenic component, and that's what we are doing with vaccines, is we want the body's immune system to start working. It does go to work. That's what it's supposed to do. So fever is part of the inflammatory immune process to get our bodies to develop armies against microorganisms. So fever is okay. And in babies, then they have fever and they're not feeling well, they cry. So when do I consider a vaccine reaction in pediatric patients or babies, especially normal versus abnormal? Criteria: if temperature is less than 104 and babies are consolable, it's normal vaccine reaction. Treated with Tylenol if needed, no aspirin. Why? Aspirin may cause Ray's syndrome. However, if temperature is greater than 104 and or the baby is inconsolable, that is a criteria for referral. So let me repeat one more time. Give the vaccine unless you see 3 things in the question. 1, patient has anaphylaxis to one of the vaccine components, or you're giving a live attenuated vaccine and the patient has low immunity, or patient has had a history of a vaccine reaction which is abnormal, especially in pediatrics, any temperature greater than 104 and or inconsolable baby after getting vaccinated. That those are criteria for referral and not giving the vaccine or being careful with administration of vaccine. Again, vaccine and vaccine administration, depending on where you are, is something that is prescribed. So follow those local regulations. But when you see questions or you're in a clinical situation where there's standing orders to provide immunization, uh, these would be considered things to consider when giving vaccinations. Of course, vaccinations also take a peek at their individual product insert before giving it. Uh, on a board exam or a test, they'll not expect you to know the product insert, but they will tease out if you understand certain principles of safe vaccine administration, and this is the criteria to look at. So again, let's review what we covered in this video. We talked about vaccinations and what the role of vaccinations are and how it gives herd immunity by preventing diseases and decreases disability and death, morbidity and mortality in individuals and community, how vaccination is part of adaptive immunity, and how artificially we can actually give somebody the actual antibodies or give them something which causes their body to create those antibodies. So the first one is passive and the second one is active. And then this actually forms what I call vaccination, which is artificial active, which is longer lasting but not immediate. And then again, if we're giving passive artificial, which is we're giving them antibodies, it's immediate, it's just not long lasting. We talked about how we can use this in real life in patients. And then we talked about different vaccine types with inactive and live attenuated vaccine. We also covered vaccine reactions, which is a high yield item, and we talked about three things to consider when you're looking at whether to safely administer vaccines or not.